Well, good afternoon to you. I'm Dr. Craig Anderson. Thank you for joining me. Today I'm going to talk about a few topics, and we are going to be covering cholesterol today. So I'm just getting all the technology lined up to work, and I appreciate you being here. It's 1 o'clock. I am sitting in my office here in St. Louis, Missouri, and we're going to talk about cholesterol. So today I really want to spend about 15 minutes and talk about what cholesterol is, what we know about it these days, how that compares to what we knew about it 20, 30 years ago, and how that applies to your daily activities and your daily life. So this is a Facebook live stream. That means I'm actually just doing this live. Almost all my videos that you'll find on Facebook or on my website are recorded, and then we get to look at it and edit it and tweak things. And I thought this live idea would be pretty cool. So this was my first time doing it. If you are watching this live, thanks for being with me. If you're watching it recorded, I appreciate you joining me. I'm going to be watching for questions. If you have anything of concern that you want to talk about, just drop that in the comments or ask a question. I'll try to answer it as we go. Additionally, I'm going to be watching the comments after we're done recording live, and so if you're watching this recorded, feel free to just make some comments, and we'll be happy to answer any questions that you may have. So as we get started, let me tell you about myself. I'm a chiropractor. I've been in the business for about 20 years. My office is located in St. Louis, Missouri, and I have a general practice, so I generally look at the patient in a holistic way. I like to make sure that we have somebody who is not drinking a fifth of Jack Daniels every day and trying to become healthy. So we have to talk about food. We have to talk about making good food choices. Ultimately, I want to make sure that the nervous system works right. So chiropractic is about connecting the head to the body, making sure the brain that controls everything is actually able to control the body's systems, cells in the body. That's what chiropractic's all about. And chiropractors historically have been interested in nutrition. And so today's topic, nutrition, is cholesterol. All right, so let's go into our conversation here a little bit. Again, if you've never been on Facebook Live before, just interact. Feel free to share. Feel free to hit that like button or the heart button, or there's like a little face button. Hit all those buttons, because it's supposed to be good for the video to have that type of feedback. So the understanding of health historically, how to be healthy, has been it's been up and down. If you look at humankind, you look at our existence as in humanity, we used to think that it was healthy to cut people, to make them bleed, to get the blood out of their body, so that the disease or the spirits would leave them through the blood. We used to think that was healthy. Turns out that's not healthy. We used to think that putting leeches on the person is going to help them become healthy by drawing out the things in the blood that are causing the problems. You don't really hear about that too much these days. If we just go back 20, 30 years ago, there were periods in our history where smoking was recommended to clean out the lungs and to be healthy. You look at ads back in the 50s. You look at these ads where you have doctors actually smoking while they're doing exams. Smoking was considered to be healthy. Now we know it's not. We used to talk about low-fat diets back in the 70s and 80s. And low-fat diets, this really isn't where it's at. Eating a low-fat diet actually increases your carbohydrate intake, which causes a lot of secondary problems. These are problems that we didn't intend. We thought if you reduce your carbohydrates, you'll actually have a healthier intake, and it turns out that wasn't the case. So cholesterol is one of those topics. It's a topic that it can be difficult to understand, because it seems counterintuitive in a lot of ways. So cholesterol historically has been considered one of the main causes of heart disease. This was based on a study done decades ago called the Key Study, where they looked at different countries. They looked at percentages of intake of fat, protein, carbohydrates. They broke down the percentage, and they also looked at the actual insides of the arteries, and that in the artery there was cholesterol. And so cholesterol was treated as the culprit. Recently, cholesterol has been found to not be quite as dangerous. In fact, an advisory panel to the U.S. government last year classified cholesterol as not a chemical of interest. It's not something you need to be interested in because it's not dangerous. So these things seem counterintuitive to the average person. So what is someone to do about this idea of cholesterol and how important it is? Well, let's start by looking at what cholesterol does in the body, and then we'll talk from there. So cholesterol builds the body. Cholesterol is a building block. It makes our membranes work. It is the actual building the components that make up the cell membrane. It reduces inflammation. It aids in digestion. We're going to get back to inflammation in a little bit, but it aids in our digestion. The end product of cholesterol turns out to be bile. And bile, as you know, digests fat, and so it's needed. It's the emulsifier when we eat. It makes the nervous system function. So cholesterol is required for nervous system function. Now, what part of the nervous system? Well, it's the myelin. Myelin covers the nerves, and it's the insulation of the nerves. When myelin is not there, nerves cannot conduct very well. This typically happens in diseases like multiple sclerosis. So cholesterol is needed to maintain the myelin covers in the nervous system. And cholesterol is really a big anti-inflammatory thing. It reduces inflammation. So if we go back to that study and we look at when you're finding cholesterol in the arteries, the cholesterol is there to actually reduce the inflammation in the arteries. It's like the firefighter reducing the inflammation, but it's been credited as being the culprit for causing the problem. Turns out that cholesterol is not the cause of the problem, it's trying to help the problem, and that's inflammation. So over the years, we've talked about a low-fat diet and reducing the amount of cholesterol that we take into our bodies, but the dietary component of cholesterol isn't as strong as we thought. It turns out about 20% of our dietary intake accounts for the total cholesterol circulating in our body. 80% comes from the liver. So cholesterol, the proper level of cholesterol in our body, comes from liver function. So we really want to have a healthy liver for us to have healthy cholesterol levels. So I'm going to talk about a couple different terminology items that come on your blood test when you're looking at a lipid profile. So two of those are the high density lipoprotein, HDL, and the low density lipoprotein. So these are commonly called the good cholesterol and the bad cholesterol. So the HDL, considered the good cholesterol, HDL is not cholesterol. It's the wrapper around a cholesterol molecule. High density lipoprotein takes, now, so I'm just going to use general terms here. This isn't exactly right, but this is a concept to help us really understand how cholesterol is working. High density lipoprotein takes the old cholesterol molecules, wraps them up, and brings them back to the liver to be processed. The low density lipoprotein is a wrapped up piece of cholesterol, and that's going to the cells. So HDL goes to the liver, LDL goes to the cells. So when we have a cell that needs some repair, the LDL is going to bring some cholesterol to the cell so that the cell can go through the process of repairing. Think of cholesterol, think of repairing. These two work together. These are key. So LDL brings cholesterol to the site where repair needs to happen. HDL brings the old stuff back to the liver to be rebuilt. It's that 80% of cholesterol that comes from the liver is recycled, is used over and over and over and over. All right? So, let's see here. No questions? All right, very good. So, cholesterol can be too low. this is where it gets interesting, because one of the main focuses of our healthcare has been to reduce cholesterol, and because we have this built-in fear of too much cholesterol. But really, we want to have a healthy amount of cholesterol. And in my view, that's going to be somewhere between 180, maybe 200 milligrams per deciliter, up to possibly 240 or so. That's about the healthy range. When you start to get higher, then you do end up with some problems. We don't want to have a tremendous amount of useless cholesterol in the body. We want just the right amount. But it's interesting to look at this idea of low cholesterol. Can it be too low? Well, cholesterol under 160 has been shown to increase depression. There was a study done out of Duke University, 121 women, and they looked at women who have cholesterol under 160. These women would score higher on depression and anxiety questionnaires. So that is interesting. The goal is not to suppress cholesterol to make it as low as humanly possible. The goal is to have it as healthy as possible. And I often find, many times, cholesterol under 140 in people who have anxiety and depression. So this is something to think about when you're dealing with that. Back last year, the U.S. government withdraws the warning about cholesterol. So this is a reference to a news item that happened back in 2017, towards the end of the year, where this was an advisory panel that meets every 5 years, and they make recommendations for government warnings. And so this group found that cholesterol is no longer considered a nutrient of concern. So we're no longer concerned about cholesterol. That seems like a major change. I was waiting for this to happen to hit the news, and I just didn't see much news on it. So cholesterol, no longer a nutrient of concern. That doesn't mean you go out and just eat only cholesterol. It means part of a normal diet is just fine. Cholesterol is in eggs, and that's okay. That's fine. I have some patients that eat a tremendous amount of fat and protein, and we take blood and we find that cholesterol is okay. So all this information I'm throwing at you just seems counterintuitive. It doesn't seem to make sense. Cholesterol has been found to be correlated to heart disease, and that is true. The higher cholesterol, the higher chance of heart disease. Well, didn't I just say the opposite? Not quite. It's not the cholesterol causing the heart disease. It's the inflammation that brought the cholesterol in that's causing it. So in some ways we're looking at, it's a little bit of a semantics game. The ultimate goal here is to reduce the amount of inflammation in our body and to not worry about the cholesterol, because the cholesterol is just doing its thing. If we reduce the inflammation, if we reduce our weight, if we maintain our weight at proper amounts, cholesterol will then become a right amount in your body. There are some liver problems and some genetic issues. We're not talking about those. That's for you to talk to your doctor about. We're talking about everyday healthy people. That's how cholesterol works in the body. So what do we do with this information? Well, if you have any comments or thoughts, feel free to ask them in the comment box. I can answer them here in just a moment if there's any questions, and I'll be happy to answer them in the recorded replay. But here's what we do. So we don't worry about the cholesterol we eat. We want to stop worrying about fat as much. So there was a study that came out last year again in Lancet that looked at 135,000 people over 10 years in 18 different countries. This is pretty interesting. You can find this on my website if you look at the fat. Just search for fat, you'll find this. So they found that people who ate higher carbohydrates had higher chance of mortality. All right, so let that sink in for a second. Higher carbohydrates have a higher chance of mortality. They found that high fat eaters had a 23% less chance of dying in the 7-year follow-up that the study was operating. So high fat eaters had less of a chance of dying. Well, why is that? Because carbohydrates include sugar, and generally that's an inflammatory thing. So when our body is more inflammatory, we have to deal with that inflammation. When you're eating fat, you generally are going to eat a little less calories. I know that's counterintuitive as well, but the more fat you eat, the more satisfied you're actually going to be in your diet. So high-fat eaters have a 23% less chance of dying. Okay, so that's most of the tidbits that I have for you in this short video on cholesterol. What I want you to take from this is that cholesterol is not the enemy. It's okay to eat cholesterol. The main thing is reducing sugar. The main thing is reducing your inflammatory state in your body by reducing sugar, drinking water, doing all the healthy things, eating vegetables and fruit. That's going to help you correct your cholesterol problem. Liver problems can also drive cholesterol problems. That's another topic. That's a process of detoxifying the liver, and we may address that in one of our weekly conversations here. So just to let you know, my intent of this weekly Facebook Live is to do just a quick 15 minutes or so on a different topic. You can find these topics at craigandersondc.com/live. You will find my next topic next week. We're going to be talking about, is cardio exercise actually necessary? So I'll give you my opinion on that. Meantime, if you're watching this live or you're watching it a replay, please share it with whoever you might think might be beneficial or might benefit from this. You can tag them, tag their name in the comments. That works too. Other than that, I believe we are done. I want to appreciate your time. I saw a few people come in live. I appreciate you coming by. I look forward to interacting with you in the comments, and you have a great day. Everything about this topic and what I talked about, references and those different studies, can be found on craigandersondc.com. I'll talk to you next week, same time, same place. Until then, have a great day. Bye-bye.